And we are joined from Saskatoon by Dr. Hassan Masri. Dr. Masri, welcome to the program.
Thank you very much for having me.
I want you to relate to us, working in ICU, on the front lines of ICU, what it's been like for you with these rising cases of COVID in the city.
The ICU oftentimes get mentioned a bit when it comes to COVID-19. And certainly the ICU could become ultimately the place where a lot of these patients might end up on life support. And we've watched with some anxiety our numbers rising and putting strain on a lot of the resources that people. I think for now our resources and our ability to handle these numbers is there, but as the numbers start to rise, our resources, both human resources and non-human resources, will become strained. But I think it's really important to talk about the non-ICU places too, because when the numbers starts to rise, then you will have canceled surgeries, you'll have canceled clinics for cancer screening, the floors that are not the ICU become full and busy, and then you have a strain on both the human and the non-human resources. So while the ICU is always mentioned in COVID-19, and sometimes even gets a lot of the credit in the management of COVID-19, I think it's really important to remember that the hospital system is a unit that is connected, and a strain on any parts of this unit will invariably put a strain on the whole system.
And what does that mean for patients out there when surgeries are delayed and the strain begins to appear in the system like that?
Well, for example, if someone needs an open heart surgery or needs a major thyroid surgery or any of these major surgeries, there's always, in the medical world, we plan for those patients that they may have to go to the ICU, for example, or a place with high observation or monitoring place to make sure that everything after surgery goes well. So when the strain starts to happen, then we say, well, it's not really safe to operate, or it's not really safe to go on with full surgery schedule, because if any of these patients require ICU, then we may not have the beds that are available for them. But also, the physicians and the nurses that care for the patients who have COVID-19 are also the same nurses and doctors who care for them when it comes to, let's say, cancer screening or whatever. So if the physicians and the non-physicians and the hospital resources are being allocated to treat the really concerning rising number of COVID-19, then certainly you will have less resources being allocated to patients who are here for something else. And invariably, it will lead to delay in their surgery, or delay in their cancer screening, or delay in many other things. And so that's why having our numbers go down and controlling our numbers is beyond just decreasing the death from COVID-19 or the hospitalization from COVID-19, but it also goes beyond that, which is that we want our healthcare system. Remember, our healthcare system is not just a COVID system. It's bigger than that. And so we want our healthcare system to be able to care for all these other people that we may not be able to do so if the numbers are really high.
Let me ask you, though, the first time I heard of you was some months ago. You went very public in expressing your concerns about COVID numbers, like a lot of people. And your Facebook page is quite popular, as it turns out. And you get lots of comments, which is great, as an exchange there of ideas. What made you want to go that public on your Facebook page?
It was a very accidental going public. When COVID-19 started, I actually received, as many people receive, messages and videos about things that are not scientifically based. And Actually, the video that really triggered all of this was a video that my own mother sent to me. Even though I am a physician in my household, my mother is the ultimate physician, no matter how many credentials I have. And so she sent me this video to tell me that, it's been studied that if you take enough garlic and onion and honey, then you'll never have COVID-19. And it was a video in Arabic, which really inspired me to make sure that, people are looking for information. And if we physicians and people in healthcare do not go out and provide that information, then that void will be filled by other people. There's a void, there's a lack of information, there's hunger for information, and somebody has to fill it up. So you either fill it up with science and medicine and things that are evidence-based, or others will fill up that gap.
What's been the reaction from people?
I personally felt...
Go ahead.
As a Middle Eastern man, I felt that here in Canada there was a lot of resources that are in English, but there wasn't a lot of resources that were in other languages. So, initially my very first video was actually in Arabic, and that's why I call it an accidental going public. I just meant to put a video of 5 to 10 minutes to talk in Arabic, that this is real, this is serious, let's take it seriously. And that while I am all for taking vegetables and natural things and improving your immunity that way, I do believe that we also need to follow the medicine. And then after that, the rest is history. I started making video after another. And when I saw that the demand is really high and people's support was there and people wanted to ask more questions and whatnot, I continued to make it. But this was probably the least planned thing I've ever done in my life.
What is your message to people in Saskatchewan with these really disturbing rise in the number of reported cases of COVID-19? So what is your message to people as a frontline worker?
My message is that, the message is simple. Science and evidence-based is how we drive our cars, how we live our lives in every little aspect of it. And I think that our message here in Saskatchewan should be, let's follow the science, let's follow the evidence. And sometimes science evolves and changes, but let's follow the best science that we have. But let's also do what Saskatchewan always does very, very well, which is to stick for each other and to help each other. I was part of the medical team that helped with the Humboldt Broncos team a few years ago in the ICU. And while the hospital overnight and in the next few days after the Humboldt Broncos event side of their door. And, to me that may seem very symbolic, but it's a very powerful statement that people are saying, even though I cannot be with you in the ICU, even though I cannot be with you in the hospital to help with those patients, but I want you to know that I'm with you. And this is my hockey stick out there to symbolize the fact that we are all together in this. And I think that spirit is what we really need today. We keep hearing about people talking about, masks interfering with their personal freedom or restrictions interfering with their personal freedom. And I think that in an ideal world, we want to have all the freedom that's possible, but not at the expense of putting others in our community or straining our system. Because at the end of the day, freedom is meant for all of us, and the medical care system is meant for all of us. And anything that interferes with that should not be tolerated. And we really, what we really need is we need to rally together. Sure, I think that it's important for the government to mandate things and to set some rules and enforce them. But I think the bottom line is what we really, really need is for us to understand that we rally together and we go down together.
Dr. Masri, thank you so much for taking time from your very busy schedule to speak with us today. We really appreciate it, and wishing you all the best and good health.
Thank you very much for having me. I appreciate it.